Before I get into the benefits of the All-on-X procedure, I think it's probably best to go back to the basics of why dental implants, just in general, are better than any other option. For example, a denture. So the big reason why is a dental implant, it consists of three different parts. You have the screw or the actual implant. Then there's the abutment that pretty much acts as the bridge or the connection between the implant that's in the jawbone and then the crown or the tooth that's then being seated on that implant. And so what's cool, I guess you can see in this picture here, you've got a healthy root or a healthy tooth, you've got the tooth root here and the bone around it, and an implant is going to mimic that. And so what happens is when we start to lose our teeth, what will happen is our bone will resorb, we'll start to lose bone density. And so I'm sure you've maybe seen people who've had dentures for a long time where, they take out the dentures and they kind of look like this in terms of what their jaw and what their mouth looks like. And the reason why is just because of the bone loss. And so as we lose our teeth, simply put, there's no reason for the bone to stay. And so what happens is at some point, if we wait too long, then we're not able to get implants. And so the reason why dental implants are so great is because they mimic the tooth root and they give your jawbone a reason to stay and to not resorb. All right. So going back to now what the All-on-X procedure is, it can consist of placing 4 or more implants into the jawbone, either the upper or the lower, and then attaching a set of teeth to those implants and fixing them onto the implants. So it's different in a denture because you don't take the teeth in and out. They're fixed onto the jaw or onto those implants. And so there's a lot of benefits. One, because of the jawbone, being able to preserve the bone there, but then also, the chewing capacity, your ability to eat and chew food, drastically improves compared to a denture just because there's actually something keeping it in place. And so that's really the main benefit of the All-on-4. That would be that in this case. Whenever you hear the phrase like an All-on-X, what that basically means is that a full set of teeth, like all of your teeth attached to X amount of implants. And so the All-on-4 was what was typical or standard. What some doctors are doing now is they're placing more implants just to give the arch more stability and just helps it last longer. There's a lot of pros and a lot of benefits by placing more implants than just having 4. And one thing that I want to point out about Ivory is our doctors, we usually place obviously at a minimum of 4, but we typically try to place 5 at least on the lower and then 6 on the top or on the upper jaw. And the reason why there's a difference is sometimes on the lowers, you have nerves that go down your jaw on your lower jaw. And so sometimes there's only so far you can go back with the implants there. But usually there's plenty of space to be able to place 5. And we always, if we can, we add more. And then like I mentioned on the top, we add 6. And that's no extra cost. We don't charge any more for that. That's just something that we do just to give patients a better chance to be able to have these last as long as possible. So anyways, it doesn't cost that much more for us to be able to place those implants, those extra ones, and it's just an added value to the patient.